Welcome, and thank you for that kind introduction. It's always a bit embarrassing having a long speech like that about your work and such, but I'm very proud of what we've accomplished as an organization in the last 10 years. We'll be heading into our 10th anniversary next year, so that's, I think, a pretty happy accomplishment for us. Hopefully I don't ruin this. Move it on. I'm going to talk a little bit about the organization for those of you who may not know about it. I notice a lot of familiar faces in the audience. I know a few people even attended our session at the Michener Institute in Toronto last spring. So it's nice to see a few of you back again, and it's always a good sign to see people coming back. That's a good sign for melanoma, which we all know can be a very challenging and persistent disease. So the organization, as we said, was founded in 2009. We're heading into our 10th year of operations. There's been a few landmarks of achievements throughout the year, but I think coming into 2018, we're celebrating the fact that we're now in publication of our 3rd edition of our melanoma patient booklet, which hopefully you'll be getting the next edition. If you've left your name with us tonight, it's actually coming out, which explains some of the new staging, some of the treatment therapies. It's hard to keep up with all the changes in the melanoma front, but I think that's a good sign because it says there's a lot on the horizon for treatment, and we're trying to capture that again with the input of some of the top physicians in the country. So the booklet that you have there today is the one that's outgoing, and the new one's coming in. So that's next on the horizon. But we've made a few landmarks over the years, such as passing legislation in Ontario to ban 18 and under from tanning beds, because we know how much UV exposure contributes to melanoma and other forms of skin cancer. So we were quite proud of that accomplishment as well. So a lot of the challenges that we have, and I know I spend a great deal of my time on a weekly basis, is not only supporting patients that call and need help with some resources or information, but we also advocate behind the scenes and also with government to get access to drug therapies. And it's no easy slam dunk in this country. A lot of these new therapies are very expensive. It takes a long time to get approval, and oftentimes patients are not in the position to be able to wait. So it can get very frustrating, very challenging. And we do get, from time to time, we're able to make some major inroads. We had a patient just this past winter, which we were able to get access for treatment that he wasn't able to get and was having to pay $12,000 a month out of his own pocket, which, we don't assume in this country that we would be bankrupt or maybe losing our house because we have to pay for therapy, but in certain cases that is the case. So we want to try to make sure that that is not an issue when a patient is faced with a disease like this. I know the stress and the anxiety that goes along with the diagnosis, and you shouldn't have to worry about financial ruin at the same time. So we're working very hard and very diligently, as your physicians are as well, to try to ensure that government is responsive to patient needs and ensures that we do have access and timely access to therapies. So annually, we're a very busy group. We're a small organization servicing a big country, and patients spread out from Newfoundland to Victoria. It's quite an undertaking, but I think we provide an exceptional service, fielding over 2,000 calls annually from patients. We do workshops like this across the country, so right from coast to coast, we'll go and help get connection for patients. I think it's important that patients have a voice. It's important that our government understands, both at provincial and federal levels, that we're only 7,200 cases a year, but we're the 8th most commonly occurring cancer in the country, and need to have a place in that funding, and we need to have access to treatment in a timely fashion. We're fortunate here in Toronto area because we have some major hospitals and some of the best physicians in the country treating this disease, but there's areas of the country that just don't have access to oncologists and specialists and people who really are familiar with melanoma, and it's really tough to be able to get in, even to see a dermatologist in many cases. So we're always dealing with those kind of issues and challenges as well. Some of our primary programs, if you've ever thought about talking with another patient, We have what we call a peer-to-peer support program where we will hook you up with another patient that's similar in diagnosis and maybe some of the same treatment therapies you've been on. A lot of times patients are undergoing a new treatment or they're getting scheduled for maybe a clinical trial and want to find out from someone else, you know, how did that work for you, or what did you find? How were the side effects? How did you manage it? Well, no two patients are going to be the same. We all differ and we're very complex beings, but it helps to be able to connect sometimes with other patients that have been through a similar therapy and can talk about their experience and their outcomes as well. So if you're ever interested in that, we do provide that as well. We have other support services ongoing across the country, support groups in different sectors of the province as well. So if you're interested in any of those resources, feel free to call us. We certainly know that there is a need for prevention and education. We do a lot as far as trying to create awareness of the disease, but also how to prevent it. And one of the things that we try to do is formulate policy and help encourage government to take this disease seriously. In many cases, not in all cases, but in many cases, melanoma can be prevented. And so there's a huge onus on us to try to get awareness out there about the need for prevention at the school level, wherever possible. And as such, we've done some amazing programming to encourage youth to not tan. That's a big uphill battle. We have the same kind of battle that I think people undertook for smoking in the years gone by. That took decades, and we still have some challenges around people smoking. So we're constantly trying to get that message out. I'm sure you're all good and knowledgeable now about wearing protection, and especially if you're heading south or anything, you want to ensure that you're following sun-safe behaviors. But it's always a challenge to get it in our youth, and so I'm sure you're out talking to your families and such about prevention with your children and grandchildren as needed. Our Sun Aware program for camps in Ontario actually puts through about 100,000 kids a year with education on sun safety and awareness. And what we do is also provide education and tools for the camps and camp counselors. And we provide a certification program for camp counselors to make them aware of the need for sun safety while children are at camp in the summer. And that's been a very successful program and very well embraced by many camps throughout Ontario. So as I mentioned before, we do a lot of advocacy. Recently, I just did 2 submissions for drug therapies for access at the adjuvant level or stage 3 patients. So we put in and if some of you participated in our survey, thank you in advance. We had a great response on the survey itself. We did one for Opdivo, which is the nivolumab, one for the targeted therapies that just went in on last Friday, and that was for the BRAF positive patients for dabrafenib and trametinib. I got those ones right. I always mix up all the names. There's too many of them to remember all the time. But that one went in, and we've got another one coming up very soon. The submission for Keytruda for adjuvant or stage 3 patients will be going in early, well, probably at the end of November, so I will be having a survey out very shortly, and I really would encourage all of you to participate in that survey. It's very easy to complete online. We will have links on our website, but this is to help get access for those stage 3 patients, and even if you are a metastatic patient now, it's important that government knows that it's beneficial that patients have access at an earlier stage where it's needed and where it's possible, so that we can prevent recurrence or potential spread of the disease. So if any of you are interested, please see me afterwards. I'd be pleased to talk with you about that, but we will have a link on our website as well, and I really would appreciate your participation. It probably takes no more than 10 minutes to complete. And so for further information, feel free to reach out to us. This evening, we're so privileged to have a panel of patients that are going to speak to you a little bit about their experience and hopefully answer some questions for you. So I'm going to invite the panel members to come up.